Today, we're going to show you types of bandages in every accident that we have set as an example. In this video, we will show you the procedures and the purpose of these bandagings in every incident, so follow along. First, we have the chest injury. Possible incidents leading to these injuries are car accidents, falls, sports injuries, and blunt force trauma. Procedure for the chest injury bandaging. Position the triangular bandage on the top of the dressing of the chest with the apex just below the armpit. Gently pull the apex in the other end of the bandage, passing around the armpit towards the back of the victim, and tie it in square knot. Extend the other end of the bandage at the top of the shoulder by tying additional handkerchief to it in the cravat using square knot. Tie the handkerchief to the extra remaining end of either apex or end corner in square knot. Fix the remaining edges to make it firm and neat. The reason why we use this kind of bandaging in this injury is because it stabilizes the chest wall, reduces pain, and aids breathing. Palm injury. Possible incidents leading to these injuries are falls, cuts, burns, and crush injuries. Procedure for the cravat on the palm of the hand. Put dressing and apply pressure, cravat apex side, and apply the bandage. Lay the middle of the cravat over the palm of the hand with the ends hanging on each side. Take the end of the cravat at the little finger across the back of the hand, extending it upward over the base of the thumb, then bring it downward across the palm. Take the thumb and across the back of the hand, over the palm, and through the hollow between the thumb and the palm. Take the ends to the back of the hand and cross them, then bring them up over the wrist and cross them again. Bring both ends down and tie them with a square knot on the top of the wrist. The reason why we use this kind of bandaging in this injury is because it protects the hand, controls bleeding, and reduces swelling. Forearm injury. Possible incidents leading to these injuries are falls, sports injuries, cuts, and fractures. Procedure for the arm sling bandaging. Put the apex of the triangular bandage below the armpit with one of the two ends at the top of the shoulder. Bring the lower ends of the triangular bandage positioned below over the arm at the end of the shoulder around the back of the neck. Tie both ends using a square knot. Twist the apex and tuck the corner of the sling at the elbow until it becomes nice and neat. Procedure to the cravat bandage to the elbow. To apply cravat bandage to the elbow, bend the arm to approximately 90 degrees and at the elbow, and place the mid portion of the cravat bandage at the elbow, bringing the ends of the bandage upwards. Roll ends gently the arm and ends the elbow in square, both around, and pull both opposite and tie it into a knot. The reason why we use this kind of bandaging is because it immobilizes the elbow, reduces pain, and prevents further injury. Forehead injury. Possible incidents leading to these injuries are falls, sports injuries, and accidents. Procedure for the cravat of the forehead. Place the apex in the middle over the dressing and apply pressure. Cross the two ends of the bandage in opposite directions completely around the head. Tie the ends using square knot over the dressing. Tuck in the excess ends to make neat. The reason why we use this kind of bandaging in this injury is because it protects the forehead, reduces bleeding, and prevents infection. Sprained ankle injury. Stretching or tearing of ligaments due to twisting and rolling the ankle. Place the center of the cravat over the sprain, cross both ends over the foot. Cross both ends at the back of the ankle and do again the cross of both ends. Lock and tie both ends using square knot. Tuck in the excess ends to make neat. Purpose of the bandaging: to provide support, reduce swelling, and help immobilize the joint while preventing further damage. We hope that you have gained some knowledge while watching our bandaging tutorial in some certain incidents. Now, you can apply this bandaging lesson if you'll ever encounter these kinds of incidents. Thank you, and see you next time.